Assalamu alaikum. Today's topic of discussion is systemic sclerosis. So we will take it as a topic, along with we will discuss important points related to history. So systemic sclerosis is basically a chronic disorder which is characterized by diffuse fibrosis of the skin and internal organs. It's a disease in which females are more affected than males, and it is present mostly in the 3rd to 5th decade of life. There are mostly two forms in which the systemic sclerosis is present: limited and diffuse. Most 80% of the cases are of limited and 20% are diffuse. So before going to the history, I wanted to know, you must be knowing about the clinical features. For limited disease, you can see Raynaud's phenomena, Crest syndrome. Crest is basically calcinosis, Raynaud's esophageal dysmotility, sclerodactyly, and telangiectasias. There can be hardening of skin, there can be digital ischemia, there can be constipation and diarrhea, there can be malabsorption due to bacterial overgrowth, and there can be dysphagia due to hypermotility and later fibrosis of the gut. And for diffuse systemic sclerosis, we can see polyarthralgias, weight loss, calcification, pulmonary fibrosis, skin thickening. In the diffuse systemic sclerosis, the skin hardening and thickening we are mostly seeing in the truncal region and the proximal extremities, whereas in the limited systemic sclerosis, we may see the skin hardening and skin tightening in the distal part, where then there can also be involvement of the kidneys resulting in renal crisis. There can be cardiac involvement and there can be GIT involved. So after discussion of the clinical features, we will see for the history. For example, if a patient comes with a presenting complaint of skin tightness for 3 months, his history of presenting illness, we are going to discuss it. It would be, we will take it as OD para. The initial line, whatsoever the patient is having, my patient is a non-smoker, non-glycemic, and either he's having any other comorbidity, you can mention it, and start with a complaint which he has presented with. For example, in this case, we have taken skin tightness, which was sudden in onset or gradual increasing, progressive, initially limited to hands, now progressing to the forearms below the elbow, also involving the mouth, and which is causing difficulty in opening the mouth and difficulty in doing household chores or even holding a pen. How it is relieved? It is relieved temporarily by using sunblocks, liquid paraffins. It reoccurs with time. It is aggravated with non-compliance to medication. However, it is not associated with any itching or redness of skin. There is no skin tightness in truncal area, no skin nodules, and there are 2 red spots which blanch on pressure. So these 2 red spots which I have mentioned is basically telangiectasias, and we have to localize where the skin tightness is depending upon to differentiate between diffuse and limited. As this truncal region is not involved, so this is limited. And we have to ask all the features of limited sclerosis, in which we have to rule out all Crest features. There is association with heartburn. There is association of Raynaud's phenomena, which we will be going to ask how change in color of the fingers from white, blue to red on exposure to cold. There is no tapering, sorry, there is a mistake, tapering of fingers, which is sclerodactyly. Then there is history of right middle finger ulcer for last 1 month, which started as a pinpoint lesion, gradually increasing now to size of a pea, getting deeper and painful, with a pain score of 7/10, now turning into black, aggravated with cold water and relieved with painkillers. So you have to describe the ulcer, how it started, is it progressive, what it was size before, now what it is the size, is it painful, how much is the pain score, how it is relieved, how it is aggravated. Then you have to rule out other features of systemic sclerosis, whether it has involved any cardiac involvement. There is no history of chest pain, palpitation, any pulmonary involvement, shortness of breath on lying flat, or shortness of breath causing awakening at night. Any GIT involvement, there is no history of any alternating bowel habits. So this is, you have to compose all the systemic sclerosis features. Then the next paragraph of HOPI, you have to discuss and rule out all other differential diagnoses of skin tightness. You have to rule out for SLE that there is no history of any oral ulcers, photosensitivity. However, she gives history of hair loss. There is no history of joint pain, swelling, redness. We are going for RA. No difficulty in climbing stairs, polymyositis, combing hairs, or any skin rash over the hands, eyebrows, or behind ears. There is no history of any organ transplant, graft versus host disease, radiation exposure, immunotherapy, any recent MRI or dialysis not being done. No history of any increased appetite, thirst, urination, or increase in fasting blood glucose, double vision, mucosal bleed, or any increase in the size of the tongue. Then after ruling out the differential diagnosis, DDs, in our history, we are going to go for care. Care is, as I already told you, complication, association, risk factors, and etiology. Etiology and risk factors, they are one and the same things. In this, we will rule out that there was no history of any female family history of similar problems, and patient was a non-smoker. However, what will be the complication and association? I have combined them together. There is no history of any excruciating pain on the face. This is trigeminal neuralgia, or chest pain, palpitation, dry cough, difficulty in swallowing, paleness of complexion, yellowish discoloration of sclera. Any shortness of breath, as we have asked earlier, we will not repeat it again. However, there is no history of any weight loss. We are going for CA lung. Then no history of decreased urine output or any pedal swelling. For renal crisis, any history of hypertension, foul smelling stool which is difficult to flush, or tingling, numbness over the fingers. This is carpal tunnel syndrome. If patient is already known case or someone has prescribed them steroids, so you have to mention the complications of those medicines. Like if he is on steroids, you have to ask for the complications of steroids. If she was on immunosuppressants, you have to ask for the complications of immunosuppressants. Then in association for systemic sclerosis, there can be rheumatological, as we have already asked, SLE, RA, polymyositis, dermatomyositis. Then there are certain non-rheumatological associations which can be, as I